Hello, my name is Dr. Sarah Park. I'm a board-certified cancer rehabilitation physician here at Mayo Clinic, Arizona. My expertise is in cancer rehabilitation. I'm here to talk with you today about cancer rehabilitation and prostate cancer. Cancer rehabilitation is a field of medicine that is dedicated to improving function and quality of life in patients with cancer. The primary aim of cancer rehabilitation is to improve patients' function and optimize their participation in community activities, work, and family life. Cancer rehabilitation is typically provided by an interdisciplinary team. This team is often led by a cancer rehabilitation physician, such as myself. The role of the cancer rehabilitation physician is to examine you thoroughly, understand your goals and values, and assess your current function, as well as track your function over time. The cancer rehabilitation physician will also help direct you to other members of the rehabilitation team as needed. This may include interactions with physical therapists, occupational therapists, speech-language pathologists, exercise physiologists, psychologists, and many other members of the team. Cancer rehabilitation can address a number of concerns, both from families and patients. This may include issues such as fatigue, bowel and bladder dysfunction, sexual dysfunction, cognitive issues, swallowing dysfunction, speech or communication issues, as well as equipment needs, home modifications. Cancer rehabilitation can also provide assistance with return to work, hobbies, and community activities. Many clinical articles have highlighted the importance of cancer rehabilitation before, during, and after cancer treatment. You may hear a term called prehabilitation or prehab that is often used in prostate cancer treatment and prostate cancer literature. Prehabilitation is typically delivered in an outpatient setting. Often you'll meet your cancer rehabilitation physician around the same time that you're meeting your other oncology providers. Prehabilitation is important to prepare you for the marathon ahead. This is a concept that was taken really from military boot camp. The idea being that if you're not prepared from a physical or psychological standpoint for the battle ahead, typically people don't do quite as well during their therapy. Back in the Civil War times, they would take farm boys and put them directly into war. At that time, many of them were nutritionally depleted and had never really exercised and didn't do very well in their battles. They found that with just 2 weeks of nutrition and exercise, that these boys did much better in war. So this concept has been applied now to many different areas, including pre-surgical, prehab, and now to cancer-related prehab. The idea is to prepare you and your family as much as possible before beginning treatment. Of course, this does not delay your treatment in any way. We work in the period between your diagnosis and over the time in which you're staged and your treatment is being planned to optimize you functionally. This typically includes a visit with a rehab physician. At that visit, we'll talk about your goals, values, current function, any clear musculoskeletal or neurologic concerns that you have, anything that's currently limiting you functionally, whether it's something psychological, social, or physical. Address these concerns to our best ability and help you to develop a relationship with a provider that may provide longitudinal care for you throughout your cancer treatment. At that visit, you may also be connected with outpatient therapy and or developed a home exercise program that's specifically tailored for you. When we're thinking about exercise in prostate cancer, there are many things to take into account. There are several rehabilitation interventions that have been tested specifically in men with prostate cancer. Many men with prostate cancer will undergo surgery, radiation, chemotherapy, and hormone therapy. These treatments have many important side effects that your oncology team will go over with you in depth. There are specific rehabilitation interventions that can be used to mitigate these side effects and improve your quality of life as you're going through treatment, as well as improve your treatment tolerance. Two of the most important rehabilitation interventions for prostate cancer patients are pelvic floor therapy and exercise. Pelvic floor therapy is usually delivered by a physical or occupational therapist. It can include education about the pelvic floor and the anatomy, as well as information about how to improve your hygiene and how different aspects of your daily routine might impact your pelvic floor health. This can be important for men who experience side effects of prostatectomy, including incontinence of urine or bowel, sexual dysfunction, or pain in the pelvic floor region. Pelvic floor therapy may also include exercises delivered by your physical therapist to help improve the strength of your pelvic floor and mobility, to improve your continence, and also to improve your sexual well-being. Pelvic floor therapy can also include manual therapy provided by the therapist, that's stretching of the soft tissue and activation of those muscles in order to facilitate blood flow to the area and improve your range of motion. Another technique used by physical therapists is biofeedback. This can allow you to directly see how you're activating your muscles on a computer screen. When started prior to prostatectomy, pelvic floor therapy has been shown to improve function and quality of life in men with prostate cancer, reduce incontinence, and improve sexual function. Hormone therapy, or androgen deprivation therapy, sometimes called Lupron, can result in abrupt loss of lean muscle mass in men with prostate cancer. For a long time, we thought that this abrupt loss in lean muscle mass was not responsive to exercise. However, recent studies have demonstrated improvement in both muscle mass, strength, and overall function with engagement in resistive anaerobic activity. There are many specific exercise recommendations for men with prostate cancer. Typically, we recommend that you are engaged with a rehabilitation team prior to engaging in exercise. This is because there can be multiple complications with exercise, and specific direction about a personalized exercise program is often warranted. The American College of Sports Medicine recently convened a roundtable in 2018. At that time, they found that exercise was safe in most cancer patients. However, there are some specific precautions that we take with patients with prostate cancer. Many patients with prostate cancer may have bone involvement or develop osteoporosis secondary to their treatment. As such, we recommend specific precautions related to the bone health. Additionally, some patients treated with chemotherapy, specifically docetaxel, can develop peripheral neuropathy. This can impact your balance and your mobility. As such, there are certain exercise recommendations that are safer in people that have developed these side effects. In particular, in patients with peripheral neuropathy, we do not recommend that they exercise on a treadmill. We prefer for them to exercise on static ground or engage in seated activities such as cycling. In general, we recommend that people with cancer return to their daily activities as soon as possible. We also recommend moderate intensity activity at least 3 times a week for 30 minutes. You might ask, what is moderate intensity activity? And typically, this is either 60 to 70% of your maximum heart rate, or, as I like to tell my patients, you could talk during this activity, but you could not sing during it. I don't know how many people are singing during their exercise, but if you're able to do that, probably means you're not working hard enough. The benefits of exercise are multiple and include reduced fatigue, improved quality of life, improved libido, improved cognition, reduced anxiety, as well as improved bone health, strength, and stamina. Recently, in animal models, exercise has also been shown to improve the vasculature surrounding tumors, which is hypothesized to improve delivery of cytotoxic chemotherapy to these sites as well. In summary, exercise can not only improve your quality of life, but it can also potentially impact the efficacy of your treatment and improve your tolerance to treatment over time. It is important to consider some of the side effects of your treatment when developing a personalized exercise program for you. As such, we do recommend that you are in contact with a rehabilitation provider to develop this personalized program with consideration of your bone health, musculoskeletal conditions, and neurologic conditions at the time of development of this program. Patients with advanced prostate cancer can also benefit from cancer rehabilitation. Many patients with prostate cancer were very active before their diagnosis and are eager to return to activity after being diagnosed or starting their treatment. There are many considerations when thinking about returning to exercise. Typically, your oncologist will have specific recommendations and precautions about how long you need to wait in order to engage in therapy. However, once you're past this period, your cancer rehabilitation physician, as well as other members of the cancer rehabilitation team, including your physical therapist or exercise physiologist, can help make recommendations about how to return to the activities that you love. Often, this will take into consideration the treatment that you've had and any side effects that you may have experienced, as well as any pre-existing disability or impairment. A thorough assessment is typically needed in order to make specific and personalized recommendations. There is not a standard return to exercise protocol. As such, having a rehabilitation team involved in your return to play, return to work, return to community activities can be very valuable. Often, I think that there is a missed opportunity to engage in rehabilitation with prostate cancer patients. Sometimes I'll see patients in my clinic who come very late, whether it's when they already have advanced metastatic disease or they've had an injury related to complications from their treatment or treatment side effects. At that moment, sometimes it can be too late to provide adequate rehabilitation care. We like to see patients as early as possible in their course. This may mean before you have any difficulty, so that we can provide the prehabilitation you need to make progress in your cancer care, tolerate the treatments, and have optimal function through the treatments. You can ask your urologist or oncology provider for a referral to cancer rehabilitation services. The role of cancer rehabilitation is really to optimize the function of the survivor. You are a survivor from the day you're diagnosed. As such, we hope that you'll be involved in cancer rehabilitation from the very beginning. Thank you very much for your time. I hope this introduction to cancer rehabilitation and prostate cancer has been helpful. I look forward to participating in your care and helping you to optimize your function throughout your cancer and cancer treatment and beyond cancer. Please feel free to continue to explore the website and see what our other colleagues have to teach you regarding prostate cancer and cancer treatment. Again, my name is Dr. Sarah Park. I'm part of the Physical Medicine and Rehabilitation Department here at Mayo Clinic, Arizona. Thank you for your time.